Hello out there in television land. Welcome to another fact-filled, fun-filled show of medical tips brought to you by my son, the Fipster, and myself. Remember, it's Your Health, your leader in healthcare information. We're going to be right back after this brief commercial message. Welcome back to the first segment of It's Your Health. Philip Benyo with Philip Benyo. Make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. And I'm donning my part-time Hazel Park jacket here. How many rings of Kobasi would you like out there in television?
Taking ham orders every day for Easter.
Speaking of ham orders, maybe we could plow into our headlines there, Fipster.
Alrighty. Omegas in the diet may help lower the risk of Lou Gehrig's disease.
Wow. Well, another thing regarding fish oil, omega-3s, we've been talking about those for years now, how they are nature's most powerful anti-inflammatory agents. There's really no reason to not take them. Make sure you get a good one, and there are good and bad ones out there, correct?
Absolutely. You need to get one that's that's purified, not the triglyceride or fatty form. You get less side effects, they work better. They're designed or tailored. You know, the PRN makes them. There's a couple of other companies as well.
Yeah, great anti-inflammatory.
Moving on. Antidote for prescription painkiller dose is okayed. The FDA just recently okayed a pack called Evizio, which basically contains the instructions for how to give naloxone, or something that will counteract the effects of opioid overdose as well as heroin overdose.
Right. Of course, if you have too much of the opiate in you, and of course there's a lot of those being prescribed these days, and abuse is sometimes out there, and you get rushed to the emergency room, we would ordinarily in the past give you this stuff through the vein that would reverse the effects, particularly the respiratory depressive effects of narcotics. Here at home, almost like a bee sting kit, you would shoot yourself with this medication and reverse the side effects of the narcotics. I think that's pretty neat.
It works actually like a defibrillator. It actually talks to you, tells you what to do, tells you to dial 911. They're going to start equipping police cars with this, so the first responders who aren't even ambulance people can actually give this medication right away, because that really can save a life.
Yeah, can't say I'm looking forward to using it, but we're looking forward to using it.
I'm looking forward to having it around.
Right.
FDA okays a generic version of Celebrex.
Yeah, you know, Celebrex, what can I tell you? It's an anti-inflammatory. It first came out, as you may know, with Bextra, and then there was another one that they took off the market that was causing strokes and heart attacks. And so the Celebrex sort of came out of that, not necessarily without side effects. That is to say, it still can cause ulcers, GI side effects. And you can't stay on that medication for a long time. There is stroke and heart attack risks. So I don't know if that's a good idea or not. What are your thoughts?
Well, I think it's, you know, I think in short-term use it's fine. We're using it for ankle sprains, strains, but it's not for I take it every day for my knees, you know. And that's just not Celebrex. That's any anti-inflammatory. And part of the Vioxx debacle was that we looked at NSAIDs as a whole and realized all NSAIDs, all anti-inflammatories increase stroke and heart attack risk when used for prolonged periods of time. And so now we limit their use significantly. But, you know, you did something to your back over the weekend, you need something to cool off for a couple of days. I think it's a great medication. It's safe, it's not narcotic. It's just a little get out of jail free pass. You can't be using it every day, though.
Right. You know, and speaking of the NSAIDs, the anti-inflammatories, Fipster, people underestimate the renal side effects. It can cause irreversible kidney damage, can increase your blood pressure. Even though they're over the counter, they're potentially bad drugs to be on long term.
Alrighty, let's move forward.
All right.
Spent a lot of time on those headlines. We have a lot to get through.
Okay.
All right, let's talk about when I get a phone call or I get a page and someone's telling me about a particular problem I have. There's a couple of little key things that will come up and pop up on my radar saying, we got to take care of this. This is something serious. This is a medical emergency. They need to get to the ER. They need to get in to see us right away. Let's go through those. Number one, agonizing thunderclap headache. What do we got?
Yeah, not good. When you have the worst headache in your life, don't stick around waiting for a call back. Just dial 911, get to the emergency room, worried about something intracerebral like a bleed or a tear. And so that's something you want to wait on.
All right, number two, paralysis of an arm or leg, unable to talk, complete loss of sensation.
Again, hightail it up to the emergency room. You might have a stroke. There's a small window in which you can have medication given to you that could reverse the potential irreversible side effects of a stroke.
Good. Chest pain, discomfort, difficulty breathing, especially with exertion, accompanied with or without sweating, weakness.
It's a no-brainer. I know the guys out there say it's heartburn, gas, indigestion. Don't putz around. Go up to the emergency room. You might be flirting with a heart attack.
Leg pain, swelling, maybe it's after a long car ride, feels tight in the back of the leg, with or without walking.
Again, an emergency, you could have a clot of so-called phlebitis, and those clots can sometimes move north into your lungs. Bad things can happen. Don't wait around for stuff like that.
Not as an emergent problem like an ER visit, but blood in the urine that doesn't hurt.
Yes, painless hematuria. Blood from any organ, I think, is something that needs attention. And if you're urinating blood and it's painless, I wouldn't necessarily wish it away, although it could go away. That really needs an evaluation.
Asthma symptoms that aren't getting better, increased tightness, wheezing, can't catch our breath, our inhalers aren't working.
Right, there is a condition called cardiac asthma, and you could be flirting with heart failure, fluid on your lungs. So everything that wheezes is not necessarily pulmonary. We see wheezes, for example, with cardiac issues, and you can actually get wheezing from reflux, believe it or not. So,
and lastly, and something we really don't talk about here, depression, feeling suicidal, feeling really down, feeling hopeless.
Again, help is out there, and we always hate to see people who end up feeling depressed, lonely, helpless, and end up taking their life. Again, that's something that we feel as though you need to intervene and intervene quickly. So don't sit around with those symptoms.
Moving on, something that I see this time of year, a lot of people will come in and say, well, you know what, I've got these dark circles under my eyes. What could be causing that? There's a couple of different things to think about.
Well, I've been doing a lot of talking, Fipster. I'm going to pass it on to you, so you could tell us.
Well, one of the first things is you could just be getting older, okay? As we age, we do have some increased blood pooling and we do get some dark circles on our eyes, but not blaming everything on age. Let's move on. It could be allergy related. Allergic rhinitis or nasal congestion, allergic conjunctivitis can cause some dark circles under the eyes. Sometimes if you're dehydrated, sometimes if you're just not sleeping very well, and that's the one we kind of always blame it on, but as I said, there's some other things. Increased exposure to the sun. We increase our melanin production when we're in the sun underneath our eyes, and that can cause these dark circles to form. When you're pregnant, that's not necessarily your problem, but some of our female patients, if all of a sudden they have dark circle under their eyes and they don't have any other particular reasons, pregnancy is a possibility. And that also goes with anemia. If your blood counts start dropping, you have a vitamin or iron deficiency, we can start to see some dark circles under the eyes.
Good point. And the skin, of course, is one of the largest organs we have. So when there's something that's going on inside, it sometimes comes to the outside. So
we're going to be talking about that more later on.
Bring it to our attention. Foreshadowing, as they say. Well, again, it's the fastest half hour. We are finished with our first segment of It's Your Health. We're going to be right back after this brief commercial message. Remember, you're watching It's Your Health. We're your leader in healthcare information. We'll be right back. Welcome back to the second segment of It's Your Health. I'm with the Fipster here, plowing through medical cornucopia.
Moving on, let's talk about some more headlines. Vitamin B does not offer any help for Alzheimer's.
Yeah, how about that? And I think that people, when they have that disease, you feel helpless and hopeless, and you kind of grasp at things, and everybody says, well, let's try some vitamins. And it turns out you're wasting your time. All you're doing is feeding the fish. So.
Smelling rosemary may improve memory.
You got to tell me about that one, because that's not on my prescription pad.
They did a pretty neat study. They took, a couple hundred people and made him try to remember where certain objects were in a room, took him out of the room, and one group was smelling rosemary while they were doing it, and the other group was not. And what they found is that group that was smelling rosemary at the time was able to remember where more things were hidden in the room. It's a very quick and dirty study, but I mean, it's kind of interesting. And so now they're taking a look at this essential oil and seeing what other functions does it have in our upper brain and for helping preserve memory. I don't think it's going to be some cure-all, but it certainly is interesting food for thought.
We'll have to get some around the office.
Energy drink cocktails boost desire to drink more.
Yeah, you know, I'm not sure why we have energy drinks. I mean, what's their value? I mean,
there really is no value. I have a cousin who's a sommelier of energy drinks. He can tell you what mood he's in for which one. There's used to only be one or two, and now there are a lot of them. And a lot of them have a lot of caffeine, a lot of sugar, and a lot of different things like ginkgo and other stimulants. The thing is alcohol, what usually tells you to stop drinking is the depressant factor of it. It kind of slows you down and makes you tired, and then you stop. Taking a Red Bull with that is problematic because it keeps you up, the sugar keeps you more awake, and it heightens your awareness and makes you think you can just keep going. And it does not have this effect of deleting the alcohol or helping you metabolize it faster. You end up consuming much more alcohol, dangerously so.
Yeah, it's all gas pedal and no brake, so be careful of those energy drinks.
Dangerous
with
stuff.
alcohol.
Trust me. Moving on, let's talk about early dementia symptoms. You know, we'll get often family members coming in, and sometimes a patient who will come in and says, I'm worried I'm getting dementia, I'm forgetting everything. Let's go over what that really means and what are the type of differences out there.
Right, well, chances are you're not getting a dementing illness. You're probably getting some early memory impairment, which is a syndrome in and of itself, sometimes age-related, can be made worse by stress, medications, and the like. And the way I kind of frame it is when I ask a patient what this is, they can say it's a pen. They may forget where they put the pen, but a dementing illness is looking at this and saying, what is it and what do I do with it? The other thing we do in the office very effectively is what's called clock drawing. And by having a patient, after we make a circle, fill in where the numbers belong on a clock dial is a good screening test for a dementing illness. Although one patient was doing it, and I know he had dementia, and he did a clock drawing test and he did it perfectly. And I just scratched my head and I said, how did he do that? And what happened was he was looking at his watch while he was doing
the
clock to take the watch off.
And I make sure we don't have a clock in the room. You know, I've already gotten burned that way.
They can be crafty, some of these youngsters. But mild cognitive memory impairment, not necessarily a big issue. Some subsets of these patients who have memory issues may go on to a dementing illness. But I think if you're concerned, you ought to get screened. Because one of the joys of medicine is there are reversible causes of dementia. That if we get you early, guess what? We're going to get you off that road and you're not going to go down a path you don't want to be on.
I think the exciting part now is the research is now looking at that. And you said it before, at MCI, or mild cognitive impairment. And what we're finding is there's age-related memory changes. Then there's this subset or transition zone called MCI, or mild cognitive impairment. And some of these people go on to develop Alzheimer's and some don't. And the real hotbed of research right now is well, how are these people not, because all these people are essentially the same with MCI, why are some of them going to Alzheimer's and some are not? And so we're trying to figure out how to kind of delay that transition zone.
So keep watching, we'll let you know.
That's what will keep you up to date. Maybe it's rosemary. Moving on, we talked about skin before, let's talk about skin again. What type of things can we look at for our skin that will tell us maybe there's something bigger going on here?
All right, why don't you look at that screen and start us off?
Well, the first thing on the headline is dryness and patches on the skin. What kind of signs is that associated with?
Well, dry skin. Thyroid disorders can sometimes do that. Anything else comes to mind?
If your blood sugar if you're anemic, blood sugar problems, certain autoimmune disorders. How about bronzing the skin and other discolorations, or maybe some yellowing?
Sure, you're worried about your liver, of course. Iron storage disorders can do that type of thing.
How about new growths?
New growths are concerning, especially if they're pigmented and have different colors, and they're kind of getting worse, if you will. I don't like watching lesions. I kind of would nip it in the bud and take them off.
How about changes in the nails? Sometimes patients will ask, well, why are you looking at my hands? You know, and how about nail changes?
Yeah, the nails can tell a lot. You can tell if you're anemic, a thyroid disorder, renal disorders, pitting, for example, you can see with certain forms of psoriasis. And there's a thing called the luna, which is kind of like the white part at the base of the nail. If that enlarges, you may be low on protein. Anything else I forgot? Or?
Well, sometimes we'll see those black spots. They can be indicative of some type of emboli. You know, we see the black spots often. We don't see the emboli very often, but sometimes we assign that there's something going on with the heart. You know, how about changes in the hardness or the dryness of the skin?
Why don't you tell us about that?
Well, again, this harkens back to some of the autoimmune disorders. It could be some type of psoriasis. There are some very rare disorders where you can lose the elasticity of the skin and you can get some very thick hardening or density of the skin. Certain liver disorders also you can see as well.
The largest organ, the skin.
Absolutely. All right, I think that just about sums up that segment. I don't have much else to talk about.
I wanted to talk a little bit about wheat belly. What do you think, Phil?
Well, you know what? You seem to be talking a lot about it. You read 2 pages of a book. Why don't you tell me about it?
I'm now an expert. Wheat belly is an interesting concept. It's actually one of the New York Times bestseller. And what they're basically telling us is the wheat that's made today is genetically modified. And it is different from the wheat of our forefathers. Our body is used to the wheat from our forefathers. Our body is not used to and cannot handle the genetically modified wheat. So 2 things happen, and 2 things only, when you eat wheat products today. First of all, it creates belly fat. And secondly, and more importantly, it is an appetite stimulant. So you end up having a bagel, cream cheese, maybe a donut, cereal in the morning. 2 hours later, you're famished and you want to eat more. And it may explain why the country is getting wide. And as an experiment, I stayed off wheat products for 1 week. You know, I had a hamburger, ate the hamburger and not the bun, and lo and behold, 5 pounds later, my belly came down, doing nothing else. I didn't exercise, and I felt I wasn't famished. So wheat belly, we're going to talk a little bit more about this, but I think it's an interesting concept that we ought to explore more.
I can tell you since January I had made a commitment to go gluten-free as well as caffeine-free and do some other things. And it has made a difference. When I commit to it and stick to it, it's amazing how much better I feel. I don't feel as tired, I have more energy, I sleep better, I can exercise better, I lose weight a lot easier. And the funny thing is I don't get hungry anymore.
Exactly.
When I decide to go off, there's a party and I have something on the weekend I shouldn't, it's like a poison. I truly do feel poison. So it's made a real big difference in my life for the last 6 months, and so I'm glad that you've kind of made the right move.
I'm a convert now, but if you're Italian,
I told him for 5 months, but it took a silly book and 2 pages to get him to convert.
You know how us fathers are. We never listen to our children. But we'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. Welcome back to the last segment of It's Your Health. I'm with the Fipster, and we were talking about wheat belly a little bit earlier. And that's tough, by the way, especially if you're Italian or Slovak, and you know, you have all these things that are
It's a commitment, but nothing's supposed to be easy.
Except watching It's Your Health.
Moving on. Niacin does not reduce heart risk. In fact, it can increase the risk of certain types of death.
You know, this, again, it's like eating meat on Friday. You know, it was a sin before, and now you know, niacin was used particularly for patients who we wanted to lower the cholesterol. And it comes out as not only a vitamin, but we have it as a prescription drug as well. And it did a decent job for those that didn't want to take statins. But here, lo and behold, we're having an opposite effect, right?
Well, it still does that. The problem is it does have a lot of side effects with it. And niacin still has a place, but it's not the panacea or, you know, the be-all, you know, natural cure to cholesterol problems. It doesn't quite lower heart risk like we thought, like the statins do, while it does lower cholesterol. And there are some dangerous side effects to it that can be deadly. So, as someone who's taken niacin, I can tell you the side effects cannot be fun. You can really flush and feel red as a beet after you take it.
It's
an interesting feeling. Moving on. With ERs, the busier the better.
It's just like us, right? Well, what they did was they found out if you have a serious problem and you go to an emergency room that's quiet, chances are you may not have as nice a result as if you went to a busy emergency room.
It's no different than a restaurant. You walk into a dead restaurant, guess what? You're going to have poor service. You walk into a place that's busy, the place will hum and your food will be good.
Right. So, you know, we do hear this from time to time. Even though Lehigh Valley has now set up an urgent center, we still get a pushback saying, well, maybe you should go to the emergency room. Well, I don't want to wait. It just turns out that you may end up being better off at a busy emergency room.
It's worth the wait.
There you go.
Absolutely. Moving on. And plus, something bad could be happening.
Exactly. Good point.
Vasectomies can increase prostate cancer risk.
Yeah, you know, this was way back when. I think they did studies on monkeys and they said, well, there might be a higher prostate cancer risk in men who had vasectomies. But it's a different type of cancer, is that right?
Well, the prostate cancer, there's kind of the low-grade, slow-growing prostate cancer that if we all live long enough, we all might have. But the higher grade ones, the ones that move a lot faster, the ones that are deadlier, those are the ones that there's an increased risk. Now let's say what that is. If you take men who haven't had vasectomies, 16 out of 1,000 will get the high grade rapid cancer. If you take 1,000 men who have had vasectomies, 19 of them will get it. So we're talking 3 out of 1,000. That's still a fair amount. If you have a family history of the rapid type of fast lethal prostate cancer, maybe a vasectomy is not the choice for you, but overall it's still a very decent contraceptive method.
Yeah, I think it's a safe procedure, and like anything else, you know, after the age of 50, get checked.
Yeah, that's actually 40 now. They moved it back.
Oh, they did?
That's right.
Okay. You're going to turn 40 soon, aren't you?
3 years, baby.
Okay.
All right. Okay. FDA improves inhaled insulin again.
Isn't this amazing? I mean, when we were talking insulin, it's always like, oh, I don't want to take a needle, and no matter what, they would avoid insulin like the plague. And now it's inhaled. Tell us more about it.
Well, it's called Afrezza, and it is an inhaled insulin. We actually had inhaled insulin out a few years ago, which just didn't work out. You could only inhale a few units at a time, so if you had a 20-unit dose, which is not a low dose, or a high dose, you had to do it like 5 or 6 times. The device was huge. It was hyper expensive. Overall, a great idea of what we can do technologically, but in implementation it was a failure. I don't know enough about the device and how this is going to work, but if you ask anybody who's actually had to give themselves insulin with the devices we have today as a needle, they'll tell you it hurts more to check their blood sugar than actually use insulin. Yeah. And while I'm glad something like this has come out, I'm not hopeful or don't really see it being a big part of our life in the future. I just don't think we need it.
No,
the injections are so good right now.
And the pens, you can just dial them, and now you can inject with these ultra fine needles. Again, as Phil said, checking the sugar is more painful.
All right, let's kind of move on to something we've seen a couple of cases this year. It's corn and tomato season. Diverticulitis. Let's talk about some of the signs and symptoms.
Right, well, first you have to have diverticulosis, which is the outpouching of the colon. And what happens, and it's mainly bad luck, a piece of stool gets stuck in that outpouch and gets inflamed and actually can act like appendicitis. You can get fever, nausea, vomiting, belly pain, and like an appendicitis, that thing can rupture. And you know, we've had a few cases of people sitting out there holding their bellies and ended up with a ruptured diverticulum, which is not good, because you end up having to have emergency surgery, maybe a colostomy, prolonged hospitalization. So if you're out there, first of all, you need to get up to date on colonoscopies to prove that you do or do not have the diverticulosis. I know there's been some talk about, you know, avoiding nuts and high fiber. I'm not sure diet has that much of a role, although it has in the past. But nevertheless, if you have the osis, you're at risk for the itis. And if you have belly pain, don't sit on that. No pun intended. It's a problem.
Yeah, if you don't respect it, it will earn your respect very quickly. And getting back to the fiber, you know, diverticulosis is something that can actually help be prevented by really staying on a high fiber diet. It helps strengthen the musculature around that bowel wall so we don't get these outpouches. So for younger individuals, it's important to stay on a high fiber diet. And for people who have diverticulosis that's not the itis yet, But the osis, that's an important time to stay in a high fiber diet. And then once you get the itis, you kind of have to stay away for that from a couple of weeks. But it's definitely, that's again one of those ER trips, you know, that it's very serious. And it is worth the wait because you often need IV antibiotics. This is something you can't fool around with some pills. That's how you end up with a bag.
Yeah, it can be unforgiving.
Do we have any more time?
Well,
we have a little bit of time, I'm told. Let's
about,
just talk some, what do you want to talk about?
I was going to talk about wheat belly again. But
oh, no, you go ahead. No, you enjoy.
No, it's all right.
I was going to talk about heartburn-related foods, but wheat belly is an important thing.
No, go ahead. We'll talk about heartburn.
Well, let's just talk, you know, it's church season. You know, it's going to the picnics, you know, a lot of fast food, fried foods, a lot of wheat belly things you should never touch. But, you know, in potato cakes, I don't think there's anything in there that's wheat belly.
No,
you know,
have all the potato cakes you want.
But let's talk about real quickly, you can look at this full screen. These are some of the things you have to watch out with the heartburn. We have to watch out, you know, meats that are definitely processed meats, fattier meats, minced meats, sirloin, you know, ham, chicken nuggets, styles, things, okay. Fats and oils, things that are fried, you know, these are things that will aggravate heartburn. Some fruits, vegetables, and juice. You know, orange juice, things that are more acidic. Lemon juice, grapefruit, those things we have to watch out for. Drinks, coffee, tea, soda, all evil. You know, we shouldn't be drinking any of those things. Grains, certain whole grains, such as macaroni and cheese, spaghetti, pasta sauce, that stuff can cause a lot of heartburn. And dairy, sour cream, milk, cheeses.
You've like ruined everyone's summer out there, Fipster.
Well, no, again, potato cakes are covered.
Okay.
But they're a little oily and greasy.
Keeping that in mind, we'll see you at our church picnic, and thank you for allowing us to come into your home, hopefully inform and entertain you. Remember, you're watching It's Your Health, your leader in healthcare information. Thank you so much.